One minute. Excuse me.
Hi, face is the chief seat of beauty, and we do a lot of work on the face. To have facial aesthetics, it's important to have facial symmetry, golden ratio, and also you got to make sure that you don't have unwanted scars. So this young guy, he's been with us for a few years now. So I've done his lip, we've got his jaw forward, cheek. We've also got his teeth done, and he's done a very good job with his fixed partial dentures. So he needs his rhinoplasty, nose job, and he also wants his moustache to be done. Now, what we're planning today is what is called as moustache transplantation. So you'll see we've got a little bit of this head shape here. So we're going to harvest the follicles right from this area. We could also go a little back. We're planning to do about 200 follicles. That should suffice. And that's going to come right here on the lip. So it's this area, if I'm not sure if you can see it clearly, but there isn't any follicle right from here till up to there. So not only is he going to get the follicles on this groove, you see, also a scar that's there, and then we're also going to cover this. So I hadn't done his primary lip, but then I've got some shade done to his lip and everything, and he really thinks that he needs a moustache more than a lip revision. Now even if I do a lip revision for him, I'll be able to get this grooving off. You know, I can get it smooth, but there's no way I can get hair follicles on there. So that's like he would need two procedures then, because I cannot combine lip revision with a moustache transplantation for him. His muscles and everything is fine already. See that? It's not too bad, it's functionally good. But the thing is, if I do a lip revision, you'll have to come back 3 months or something again, and then we'll have to do a moustache transplant. Unfortunately, he works outside, he doesn't have the time, so he's going to bypass the lip revision now. We're going to do the moustache thing for him first, and I hope that's going to suffice, because we're going to make the hair follicle even grow from the scar. The implantation technique and the preparation of the slit differs though. As you can see, these follicles are thicker. Once they go on the lip, after a few months we see them getting thinner. Initially they're also in multiple groups. We need the density as well to get a thick moustache and also to cover the scar. So that's the area I've marked out. Inside this is where we're going to put the hairs. So it's going to give him hair in the normal skin where he doesn't have the follicle. We're also going to transplant hair follicles into the scar. So I've already given him a block. We've given an injection at the base. Now we're giving the tumescent before you can make the slits. This is needed to make the lip tense, and the slitting and insertion technique is also going to be different. You're going to see that in a while.
So you can't have it more densely packed because these follicles that we are transplanting also need vascularity. And also with the lip, what happens is if you put it very close, when you put the next one, the earlier follicle tends to pop out. So it's a thin line between thick density to what you would want to actually take. We do this for our patients, and then if they need a few more follicles, we can always do this later because it's a very, very simple, super quick daycare procedure. I wouldn't call it simple, but it's a daycare one. Follicles now in this area where he didn't have hair on the mustache region, and also we've transplanted the scar region. So they got to be careful in the immediate hours in the first few days. We send them over with a spray of saline, and we advise them to use it every hour. This is for the first 3 days. They come back for review on day 3, and then the next set of instructions follow. Again, it takes about 6 to 9 months before you can have full results or maximum results visible.